Hello, my name is Allison Kaipanen. Who here has seen the horror movie Split? For those who have not seen the film, Split, directed by M. Night Shyamalan, is a petrifying film about a man named Kevin who has multiple personalities, one of which he manifests by transforming his body and becoming the Beast. Today, we will be discussing the actual psychological condition that Kevin struggles with in the film. Today, we will delve into the mysterious world of dissociative identity disorder. Coming from a technical high school where I was enrolled in the Health Technology and Careers program, I've previously studied psychology and psychological conditions. Out of my own fascination, I have researched dissociative identity disorder extensively over the last year. I have also watched and studied Split several times to develop a deeper understanding for DID. Whilst the movie is far-fetched in terms of horror, the director did stay true to the symptoms and the experience of an individual who struggles with this condition. Dissociative identity disorder is a rare condition in which an individual contains two or more personalities that reside in their mind. Today, I will provide insight on defining, describing, and treating dissociative identity disorder. To begin with, I will discuss the medical definition, cause, and basic facts of dissociative identity disorder, which I will from here on out refer to as DID. By definition, DID, formerly referred to as multiple personality disorder, is defined as a rare condition in which two or more distinct identities or personality states are present and alternately take control of an individual. DID is the result of traumatic childhood abuse. Everyone is born with personality traits that can formulate various identities, and as we grow up, these traits mold into one distinct identity. Childhood abuse causes certain personality traits to become increased or brought to the forefront during traumatic situations. Repeated trauma causes protective and defensive personality traits to formulate various identities that serve to keep the primary identity from experiencing harm. The primary identity is a term used to refer to the personality and identity of the person whom the other personalities and identities, also known as alters, inhabits. DID is more common amongst the female population. The onset of DID is 5 to 10 years old, which with official diagnoses occurring up to the age of 30. However, most individuals remain undiagnosed. Now that I have discussed DID's definition and causes, I will identify and describe DID's powerful symptoms and side effects. The most common symptom or sign of DID is the presence of two or more distinct identities or personality states. Each identity has its own interactions with the outside world. Some describe this experience as possession due to lack of control over their alters. Another symptom of DID is the disruption in identity. This includes a change in sense of self, behavior, consciousness, memory, perception, cognition, and motor function. Also prevalent with DID is gaps of memory in personal history for the distant and recent past. The recurrent gaps are not consistent with typical memory loss. Another sign of DID is the existence of significant distress or impairment in social, occupational, and everyday functioning. The 5 core components of DID is amnesia, identity confusion, identity alteration, depersonalization, and derealization. Identity confusion is a sense of confusion about who someone is, who oneself is. For example, when someone feels emotions of excitement or thrill while they're recklessly driving, that would be associated with identity confusion, because usually with reckless driving you wouldn't feel excitement. Usually you would feel detest in some way. Identity alteration is a sense of being distinctly different from a part of oneself. So one who experiences alternating identities can also experience distortions in situation, time, and place. It can also be presently seen when one uses different languages, facial expressions, or tone of voice. Depersonalization is the sense of being not in or being detached from one's body, which is commonly referred to as an out-of-body experience. This can include visually not recognizing oneself in the mirror. Derealization is the sense of the world or surrounding environment not being real. To someone with DID, it looks as if they're looking at the world through a veil, or they're watching it on a TV screen. DID is really scary to live with when it's misdiagnosed or misunderstood. The significant gaps in memory loss occur due to an alter coming to the forefront of the host body for any period of time. The confusion and anxiety caused by unawareness of the condition often lead to depression, anxiety, paranoia, insomnia, loss of appetite, irritability, seclusion, and distrust of self and others. More extreme signs that can be caused by the unknown existence of DID include substance abuse, self-harm, and suicidal thoughts or actions. In order to hopefully overcome the symptoms and side effects I just described, we will now go over the diagnostic procedures and treatment options for DID, as well as its prognosis. Although DID is not something one can prevent due to its unexpected development, there are diagnostic procedures and treatments available in order to better cope and understand the condition. The diagnostic procedures for DID is a tricky process that is completed by the individual and one or more psychologists. Multiple talking sessions occur between the psychologist and the individual, who may or may not be aware that they have DID. They could just be going to get help for depression or any other symptom that is associated with DID, and the psychologist can help them identify if they have DID or not. The psychologist helps them identify if they have DID or not by connecting the individual's personal life experiences with the background information and symptoms of DID. The individual discusses if they have endured childhood abuse, if they are still enduring abuse, and how they function or do not function on a day-to-day basis. Psychologists refer to the DSM-5 for diagnosing DID. The DSM-5 is a diagnostic and statistical manual for mental disorders, which covers all the main aspects and symptoms of DID. Telltale signs of the condition are gaps of memory loss, frequent emotional changes, distress, anxiety, childhood abuse, and the existence of alters. Treatments such as therapy, like emotional or psychological counseling, can be used to connect the individual to their alters and feel more at peace with the condition. The outcomes are usually favorable. The condition is sometimes incurable, but alters may disappear or come out less frequently over time, especially when an individual is in a positive environment long term. So the protective identities and alters can come out less frequently if the individual is in a situation where they do not need to be protected by their alters. The violent or harmful alters are identified and talked to in hopes of changing their behavior. Alters that hold the memories of childhood trauma are also identified and talked to try to understand the cause of the condition better. The long-term goal involves helping various alters to make contact and eventually merging into one. And what this means is identifying all the alters that reside within the individual and trying to get them all on the same page into understanding what the individual is going through, and being able for them to all communicate, which can be done via handwriting. Most alters, they have different handwriting, and they can all write in a journal and talk about their experiences and what's going on with them. Or they could possibly record their voices and then play it back so, the other alters can hear them. Hypnosis is also a commonly used treatment. So an individual can be hypnotized to forget an alter or possibly to remember something from the past, but hypnosis is used as well. Medications for the side effects, such as depression or anxiety, can also be prescribed to the individual. The prognosis, and prognosis is like the long-term effects after diagnosis, after treatment, what's going to happen. The prognosis of DID is usually a good outcome. The treatment, like any mental recovery, is a long and painful journey that takes a lot of dedication and self-love and self-respect for the individual. They will hopefully identify all their alters and empower their alters to integrate and become into a full functioning being. The treatments cannot completely get rid of DID, but they can significantly, manage and cure some of the symptoms, such as the depression or the anxiety, the irritability, loss of appetite, things like that. People usually never completely recover from DID due to the fact that their alters are there to protect them from traumatic situations. So even if they're in the process of treatment and recovery, if that individual is to experience a harmful situation again, their protective alters can be triggered to come out. Overall, the diagnostic procedures, available treatments, and prognosis for an individual with DID can greatly help them in their voyage to understand and heal themselves. So today, we have defined, described, and treated the psychological conditions in dissociative identity disorder. After absorbing all this information, what do you now think of the film Split? Do you understand more about Kevin and why he acted and performed the way he did? Of course, Split is an exaggerated horror film, but the concept and background remain true. There are millions of people suffering with DID every day, and they often do not get the help they deserve. I hope I have brought awareness and informed you all properly on dissociative identity disorder. After all, there is still more to it than meets the eye.